Joining us now is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning.
Good morning.
Well, it sounds like we're moving in the right direction on vaccines, but it seems like people are sharing codes, which could cause some problems. Talk about what that is, what people are doing out there.
Well, there's no walk-in vaccine place. So what you have to do is you have to register online. You have to fill out a couple little questions, and then they give you a code. What people are doing is they're basically gaming the system and using and sharing codes that were approved. It's just, what do you expect? When the system is kind of crazy as this and people really feeling desperate, this is just going to happen. The point is to get everybody vaccinated and to get the higher risk people first. And, it's got to be clear and transparent. And, if people are still struggling, they're going to game the system.
Let's talk about the fact that this COVID-19 surge, they say, has weakened. Does this mean we're over that hump in the graph that we always talk about? Well,
we're over the third wave. The post-holiday wave. It's definitely coming down 56% in the last 30 days. That's really pretty dramatic. But if you look overall, just even look at the numbers here in the state, still thousands of people are getting infected every day. The hospital numbers haven't really changed that much, and there's still dozens of people dying every day. Okay, this is better, but this is not good enough.
And what about the CEO of Johnson & Johnson said we're going to have to take a vaccine every year for several years. Does that surprise you?
No, we've actually been saying this for the last couple months, or suggesting that this could be the case. In other words, that we go from a pandemic status, out of control worldwide, down to an endemic status, kind of like influenza, where the vaccine has got to be changed every time there's a new variant. Maybe it's every year, maybe it's every 6 months. We certainly have the technology to do it now, but this vaccine issue may actually just continue for the next couple of years, with the vaccine changing every so often.
All right, let's get to some viewer questions. This person says, if a person has had both doses, isn't the point of the vaccine to protect the person from infection? If there's continued risk of contracting the virus post-vaccination, isn't that counterintuitive?
No, it's intuitive. You would think that if you had the vaccine, you were protected. The problem is that we haven't been able to do it fast enough, and so the vaccine has been able to mutate, which attenuates the effect of the current vaccines. So, and nothing is 100%, and it's still pandemic status here. So, not everyone is actually all protected. So it's not 100% protection, and the virus is changing. So you still have to be careful at this point. When the numbers really come down, that will go over, like in Australia.
All right, next question. A 40-year-old man had his first Moderna shot, and within 30 minutes after the shot developed a fever, chills, vomiting, and swelling. He self-administered an EpiPen and symptoms dissipated. Should this person take the second Moderna shot 4 weeks from now?
I don't think so. He must be allergic to something in the vaccine itself. And he should wait for one of the newer vaccines that uses a different technology, such as the J&J vaccine, which will be coming out shortly. So he can wait. Probably too dangerous to take the second Moderna one.
All right. Next question. When I got my first vaccine shot, I felt the liquid leak down my arm. Should I get revaccinated with the first shot? I'm a 66-year-old female with type 1 diabetes.
A couple things here. One, this person definitely needs a vaccine. Second thing, liquid leaking down the arm. I mean, the nurse or technician, if they had, somehow messed up, they would have known, and they should have said something. The liquid could be actually from the alcohol wipe, when they put the alcohol wipe after the injection. And sometimes there's a drop or two of vaccine fluid still in the syringe, and as they take it out, it comes in. Most likely, this person has received plenty of vaccine. And the good news is that there's actually pretty good data out there that a slightly lower doses may actually be just as effective. So there's a whole bunch of reasons not to worry.
All right.
Just go for the second shot when they're ready.
All right. Thanks, Dr. Murphy. If you have a question for the doctor, you can go to our Morning News Facebook page and post it there. We'll talk to him again tomorrow. Thanks, doctor.
All right, have a
Thank
good
you,
day.
doctor.
Hey, Polly.